When your kidneys are compromised, even the food on your plate can pose a threat. Every bite, every meal, every decision matters. And when it comes to meat, the confusion only grows. You've probably heard conflicting advice: cut back on meat, avoid red meat, go plant-based. But here's what most people won't tell you: not all meat is harmful. In fact, some types can actually support your kidneys. That's right. The right meats can help lower inflammation, strengthen your muscles, and even reduce creatinine levels. The key isn't to avoid meat altogether, it's to choose the right kind. Because not all proteins are created equal. Some are overloaded with phosphorus, sodium, and additives that overwork your kidneys. Others leave behind excess waste your body can't filter. But certain meats are clean, lean, and full of the nutrients your kidneys actually need. In today's video, you'll discover the top 3 meats that are truly kidney-friendly, not just for early-stage CKD, but for every stage, even dialysis. We'll show you which ones reduce creatinine buildup, support heart and vessel health, and how to prepare them safely. No fancy ingredients. No expensive recipes. Just real food that helps your kidneys heal. So stick around, one of these meats might already be in your fridge. But if you've been cooking it wrong, it could be quietly causing harm. Before we dive in, hit that like button, subscribe for more kidney-saving tips, and drop a comment below. Have you ever been confused about which meats are safe for your kidneys? Let's get started, because your kidneys deserve better, and so do you. Meat 1: fresh white fish. If your kidneys are struggling and your creatinine levels are creeping up, there's one meat that stands out as a true game changer. It's not red. It's not processed. It doesn't come in plastic or a can. It's fresh, light, and incredibly clean fresh white fish. Gentle, nourishing, and easy on the kidneys, white fish has supported patients across all stages of CKD, from early decline to dialysis and even post-transplant recovery. The reason? It delivers powerful nutrition without overloading your kidneys. Let's start with the most important piece: clean, high-quality protein. Your body still needs protein to heal, repair muscles, and support immunity. But too much or the wrong kind creates harmful waste. White fish gives you just the right amount. Just 3 ounces of cod, haddock, or tilapia offers 19 to 22 grams of easily absorbed, low-waste protein. Enough to maintain strength without putting stress on your kidneys. Even better, fish protein has a high biological value, meaning your body uses it more efficiently, producing less nitrogen waste, less urea, and less creatinine. That's exactly what you want when your kidneys are already under pressure. Now let's talk phosphorus. White fish contains only 150 to 200 milligrams per serving, and here's the critical part: it's organic phosphorus. Your body only absorbs about 30 to 60% of it. Compare that to processed meats, where inorganic phosphorus is absorbed at over 80%, a massive difference that could protect your bones, heart, and kidneys. Worried about potassium? Don't be. White fish is low, typically just 200 to 250 milligrams per 3 ounce, well within the safe zone, even for patients prone to hyperkalemia. And for heart health, white fish is a clear winner, less than 1 gram of saturated fat per serving. That's essential, since kidney patients face a much higher risk of heart disease. Plus, it's liver-friendly, much easier to digest than red meat, making it ideal if you're dealing with fatty liver or metabolic issues. It doesn't stop there. White fish gives you a small dose of omega-3s like EPA and DHA, natural anti-inflammatories that support brain, nerve, and kidney function. And unlike organ meats or shellfish, white fish is low in purines, meaning less uric acid, lower gout risk, and fewer kidney stones. Let's not forget the micronutrients. You get vitamin B12, 1.2 to 2.5 micrograms for nerve protection and anemia prevention. Selenium, 30 to 40 micrograms, a powerful antioxidant that shields kidney cells. Niacin, boosts circulation and lowers bad cholesterol. And here's the best part, it's simple to prepare, easy to digest, and won't leave behind excess waste. Just 3 to 4 ounces, 2 to 3 times per week, can make a meaningful difference. Still not sure? Let me tell you about David. He had severe bone pain and was eating deli meats daily. His phosphorus shot up to 6.8. He felt itchy, drained, and hopeless. Then he made one simple change, switching to baked cod with lemon and olive oil. No breading, no salt. Within 6 weeks, his phosphorus dropped to 4.2, his itching vanished, and his labs stabilized. One small shift. One smart protein. One powerful result. But remember, quality matters. Choose fresh, wild-caught, or responsibly farmed fish. Avoid breaded, frozen, or pre-seasoned varieties loaded with salt and additives. Cook it right, bake, steam, or grill it with herbs, lemon, garlic, and olive oil. No sauces. No shortcuts. Because white fish isn't just meat. It's muscle support. It's healing. It's protection. And for anyone living with kidney disease, it's one of the smartest proteins you can choose to help lower creatinine and safeguard your future. Meat 2, skinless chicken breast. When it comes to kidney-friendly meats, one option stands out as both familiar and effective: skinless chicken breast. It's simple, accessible, and when prepared correctly, it can become a nutritional lifeline for people with kidney disease. As kidney function declines, your body starts losing more than energy. You begin to lose muscle mass, strength, and key nutrients needed for healing. Without the right protein, your albumin levels drop, your immune system weakens, and your body becomes vulnerable to infections, swelling, and even hospitalization. But chicken breast gives your body a chance to fight back. Just 3 ounces of skinless chicken breast provides 26 grams of high-quality, biologically valuable protein, the kind your body can absorb and use efficiently, without producing excess waste. That's critical, especially for dialysis patients, where protein energy wasting affects up to 75% of individuals. Low albumin levels, below 3.5 g/dl, are linked to increased risk of infection, poor wound healing, and fluid retention. Chicken can help naturally raise albumin, safely and effectively. And it's not just about protein. Skinless chicken breast is low in saturated fat, with less than 1 gram per serving. That's a big win for heart health, important because CKD patients are significantly more likely to suffer from heart attacks, strokes, and high blood pressure. Chicken supports your muscles and protects your heart. In terms of phosphorus, chicken breast contains around 190 milligrams per serving, and it's mostly organic phosphorus, which your body absorbs less readily than the inorganic phosphorus found in processed meats. That makes it a safer option for your kidneys. Its potassium content, around 220 to 250 milligrams per 3 ounces, also falls within a safe range, even for those at risk of hyperkalemia. And compared to red meat, chicken is lower in purines, reducing the risk of high uric acid and gout flares. Let's talk micronutrients. Chicken breast delivers vitamin B6 for nerve health and to reduce CKD-related inflammation. Zinc essential for taste, immune support, and wound healing. Selenium a potent antioxidant that protects kidney tissues. Iron to prevent renal anemia and boost energy levels. It's a powerful nutritional package as long as it's fresh, clean, and prepared right. Take Susan, for example. She relied on frozen chicken patties, quick and convenient, but packed with hidden phosphorus and sodium. Her phosphorus climbed to 5.8, and she developed sharp bone pain. A heart scan even revealed early vascular calcification. Her doctor urged her to switch to fresh, skinless chicken breast, no breading, no additives. Within 2 months, her phosphorus dropped to 4.1, her calcium balance improved, and her bone pain vanished. One simple switch. One smart meat. One dramatic improvement. But remember, how you cook it matters. Avoid prepackaged marinades, powdered seasonings, and gravies. They often hide harmful ingredients like phosphates, MSG, sodium, and potassium additives. Instead, flavor your chicken naturally with lemon juice, garlic, turmeric, ginger, cilantro, or olive oil. Bake it, gently grill it, poach it in low-sodium broth, or air fry with fresh herbs. Keep it clean and kidney-friendly. Portion control is key. Stick to 3 to 4 ounces, 2 to 3 times per week. If you're on dialysis, you may need more, about 1.2 to 1.4 grams of protein per kilogram of body weight daily, but always consult your renal dietitian. Too much protein, even the good kind, can still increase creatinine and burden your kidneys. When eaten the right way, skinless chicken breast becomes one of the safest and most effective meats for kidney patients. It's clean, gentle, and packed with healing power. It builds strength, protects your heart, helps manage phosphorus, and most importantly, gives your kidneys a little room to breathe. Meat 3. Fresh turkey breast. Often overlooked in favor of chicken or fish, fresh turkey breast is one of the most underrated yet powerful choices for kidney health. If you're living with CKD and trying to preserve every ounce of strength, this clean, lean meat can be a game changer, especially when prepared the right way. It's not just safe, it can help lower creatinine, support muscle maintenance, and protect your kidneys at every stage. Let's start with what matters most: protein quality. Just 3 ounces of fresh turkey breast delivers 25 grams of complete, high-quality protein, essential for preserving muscle mass, preventing protein energy wasting, and fueling cellular repair. This is crucial, especially as declining kidney function accelerates muscle breakdown, worsens fatigue, and leads to dangerous weakness. Turkey gives your body the fuel it needs to stay strong and recover. And it's incredibly lean, with minimal saturated fat, no greasy skin, no hidden oils, and no added hormones. That's a win for heart health, because the truth is, most people with kidney disease don't die from kidney failure itself. They die from heart complications. Turkey supports circulation, protects blood vessels, and helps regulate blood pressure without burdening your cardiovascular system. What makes it especially kidney-friendly is its low phosphorus content, just 190 to 200 milligrams per serving, mostly in organic form, which is poorly absorbed by the body. That means lower phosphorus levels in your blood, reduced risk of bone disease, and protection against calciphylaxis, a serious and often fatal complication in kidney patients. Its potassium content is moderate, around 250 milligrams per 3 ounces, manageable for most, especially when paired with low-potassium sides like white rice, sautéed bell peppers, or cucumbers. But turkey's benefits go beyond macronutrients. It's a rich source of essential micronutrients kidney patients often lack. Niacin, 2.5 milligrams, improves circulation and cholesterol levels. Vitamin B6, 0.5 milligrams, supports nerve health and reduces fatigue. Selenium, 28 micrograms, protects kidney cells with strong antioxidant activity. Zinc, 2.66 milligrams, enhances immunity, wound healing, and taste. Iron, 1.2 milligrams, helps fight renal anemia and restore energy. In the right form, turkey isn't just food, it's medicine. But here's the catch: most people eat it in the wrong form: processed, brined, cured, or deli sliced. These versions are loaded with sodium, phosphate additives, potassium preservatives, and hidden sugars. They might taste good, but they silently drive up your creatinine, phosphorus, and swelling, undoing all your hard work. That's why fresh, plain turkey breast is non-negotiable. No injections, no marinades, no chemicals, just pure meat you season yourself. Take Robert, for example. He struggled with fatigue, brain fog, and dangerously low albumin, just 2.8 g/dl. He was eating turkey sandwiches from fast food chains and processed deli meat daily. His labs kept getting worse. Once his doctor stepped in, he made the switch. Robert began baking fresh turkey breast, no breading, just olive oil, herbs, and a squeeze of lemon. In just 3 months, his albumin rose to 3.6, his energy came back, swelling decreased, and his mind felt sharper than it had in years. No magic pill, just a smarter protein choice. Roast it slowly at low heat to preserve nutrients. Use anti-inflammatory herbs like rosemary, thyme, and garlic. Avoid pan frying or high-heat grilling. These methods produce AGEs, advanced glycation end products, toxic compounds that damage kidneys and blood vessels. Instead, try herb rubs, lemon garlic marinades, or braise it with kidney-safe vegetables. Portion matters too. For non-dialysis patients, stick to 3 to 4 ounces, 2 to 3 times per week. Dialysis patients may need more, 1.2 to 1.4 grams of protein per kilogram of body weight daily, but always consult your renal dietitian. If you notice signs like a metallic taste, dry mouth, or poor sleep after meals, your body may be struggling with excess protein. When done right, fresh turkey breast becomes a powerful tool, one that protects your strength, supports kidney function, and helps lower creatinine naturally, gently, and safely. And here's your final reminder: choosing the right meats is only half the battle. How you prepare them is just as important. Even the cleanest protein can turn harmful if cooked the wrong way. Your kidneys deserve better, and you do, too. When it comes to cooking for kidney health, simplicity is safety. The right methods can turn basic ingredients into powerful medicine, while the wrong ones quietly push your kidneys closer to danger. So let's walk through the safest, most effective ways to prepare your top 3 kidney-supporting meats. 1. White fish. Best methods: baking or steaming. Choose fresh varieties like cod, tilapia, haddock, or sole. Rub the fillet with a little olive oil, sprinkle fresh herbs like dill, parsley, or thyme, and top with a slice of lemon. Bake at 350 degrees Fahrenheit 175 degrees Celsius until it flakes easily with a fork, usually 15 to 20 minutes. Prefer steaming? Add ginger and lemon slices to the water for a subtle, healing flavor. It keeps the fish moist, soft, and easy to digest. Avoid frying, breading, or using pre-seasoned frozen fillets. These are often loaded with additives and hidden phosphorus. Keep it clean and minimal. Simple is safest. 2. Skinless chicken breast. Best methods: baking, poaching, or gentle grilling. Marinate in lemon juice, garlic, and herbs like rosemary or cilantro. Let it sit for at least 30 minutes to enhance flavor without salt. Grill it over medium not high heat to avoid the formation of AGEs, advanced glycation end products, which harm the kidneys and blood vessels. Poaching in low-sodium broth or baking with turmeric or ginger adds anti-inflammatory benefits. Avoid prepackaged spice mixes, bottled sauces, MSG, or processed flavor enhancers. Let nature season your meals and let healing lead the way. 3. Fresh turkey breast. Best methods: slow roasting or braising. Preheat your oven to 325 degrees Fahrenheit 160 degrees Celsius, rub the turkey breast with olive oil, crushed garlic, and fresh herbs like sage or thyme, then roast it slowly to preserve moisture and nutrients. You can also braise it with kidney-safe vegetables like zucchini, onions, or carrots for flavor without salt or sauce. Avoid brined, cured, or injected turkeys. These often contain phosphates, sodium, and chemicals that your kidneys can't process. Skip high-heat grilling and frying, which increase inflammation and toxic byproducts. A few simple kitchen rules: use glass, stainless steel, or ceramic cookware, not non-stick pans that may release harmful chemicals. Stick to portion sizes of 3 to 4 ounces, roughly the size of your palm. Season with lemon, garlic, turmeric, fresh herbs, and black pepper. Avoid salt, bouillon cubes, powdered marinades, or bottled sauces. Drink water during or after meals, not before, to help reduce bloating and fluid overload. And most importantly, listen to your body. Eat slowly. Notice how you feel. Food isn't just fuel, it's a message. It's either healing you or harming you. Conclusion: your kidneys deserve better protein. Your kidneys work silently every day, filtering and protecting you. When they're weakened, the wrong foods, especially the wrong meats, can silently accelerate the damage. But you're not powerless. Every meal is a choice. And with the right meats, you can start taking your power back. You don't have to give up meat, you just have to be smarter about it. Today, you learn the top 3 kidney-safe choices: white fish, gentle, low in phosphorus, easy to digest. Skinless chicken breast, powerful protein, heart-friendly, and immune-supportive. Fresh turkey breast, lean, rich in minerals, and protective against creatinine buildup. They're not processed, not brined, not laced with dangerous additives. They're clean, healing, and safe, but only if you prepare them with care and stay consistent. Make good choices consistently, day by day, week by week, and you'll start noticing real changes: more energy, less swelling, improved lab results, and confidence in your health journey. You'll feel in control again. And that's what matters most. Now it's your turn. Which of these meats surprised you the most? Have you tried them before? Are you ready to swap processed meat for real healing protein? Share your story in the comments. I read every one, and your experience might inspire someone else. If this video helped you, tap the like button, subscribe, and turn on notifications so you never miss a tip. Stay tuned, stay strong, and always remember, your kidneys deserve better, and so do you.